Yeah, I'll try. Can you hear me? Yeah? All right, Glenn.
Kylie didn't think hers would work. I think I was just using it wrong. Okay, please take your seats. Great. Okay.
Is your mic on? Tap your mic, please.
This one?
Yeah, it's probably turned off. Take Kylie's mic, use hers.
This one? Okay, it's working?
Yeah.
Okay, good. Okay, we're going to get started with the second panel, Global Health. And I would like to remind all of the panelists to hold the mic close to your mouth. And the reason we're asking you to do this and that we want you to speak up so much is because we are live streaming. And although people in the room may be able to hear you if you're not speaking into the mic, it does affect the live stream. So just keep it as close to your mouth as possible. And we will go with the order that's on everybody's schedule. Is there anybody in the room who does not have a schedule? 1, 2. Okay. Let's see. Okay, great. All right. And then, okay, good. Okay, so that means we start with Alexis. And if you could say your name and your college before you start your presentation. Okay, and then we'll just go in this order. All right, thanks.
You're welcome. Hi everyone, my name is Alexis Smith and I am from the City Colleges of Chicago.
We'll get it to work. Okay, we're set now.
Originally, when I was awarded this fellowship, I wanted to go to Guatemala to investigate the lack of accessibility there for people with disabilities. But when I learned that there were volcano eruptions, I knew that it wasn't safe for me to travel there. So I decided to take the offer to go to Puerto Rico instead. In Puerto Rico, I traveled to San Juan, Old San Juan in Carolina. While I was in Puerto Rico, the very first thing I noticed is how difficult it was going to be for me to get around because there was only one wheelchair accessible taxi. And that made me realize how much I take for granted the system that I had back home in Chicago, where I can just take a taxi every 15 to 20 minutes. And I also noticed in my free time that going to the beach and getting close to the water was going to be quite difficult because even though there was a ramp, it led to stairs.
That's a great picture.
Thank you. So today I'm going to tell you about 4 stories about how people were impacted by Hurricane Maria. Meet Keishla Barlone, who is a journalist for a local newspaper where she lives, in Carolina. She has muscular dystrophy, which means that it makes it very difficult for her to breathe because she loses muscle tone within her body. Her story was very powerful because she struggled physically, emotionally, and mentally. Due to her disability, she uses a power wheelchair. And because the water from the disaster came into her house, it damaged her wheels on her power chair. It also damaged the motor to her motorized bed, which she used to elevate her legs at night to prevent leg cramps. But even if Keishla could use her wheelchair, she was still trapped in her house because there was a big tree right in front of her doorway that did not get cut down without the help of her neighbors. Keishla went to FEMA, which is the Federal Emergency Management Agency, to ask for assistance in replacing her equipment. And they said no, simply because she has a job. Meet Mildred De La Torre, Millie for short, who is a resource developer for a program for people with disabilities called MAVI. Since Hurricane Maria, her main job was to deliver donated equipment for people with disabilities, such as manual wheelchairs and breathing machines. So MAVI helps out where FEMA falls short. Meet Diana Futes, who is a former special education teacher for students with disabilities in the 3rd through 5th grade. Her story also stood out to me as well because after Hurricane Maria, she and her colleagues were the only ones to clean up the classroom once classes resumed because no one else was taking the initiative to do so. Diana also offered physical therapists the opportunity to give their patients their sessions in her classroom since their trailer blew away in the natural disaster. In the school where she worked was also the place where people were given vaccines. And last but not least, meet the Quinoneses. Brothers Daniel and Emmanuel with autism and their mother Laura. When Hurricane Maria happened, she and her husband, their father, Louis, noticed that their sons were acting out because their routines were disturbed. Daniel was out of school for a month, and when he returned, his parents realized that the teachers were giving the students projects just to make up for work that was missed, and also it was 6 hours worth of work crammed into 2 hours. And they not only had emotional or educational difficulties, they also had financial difficulties as well, because their dad lost his job due to the fact that he has diabetes and he couldn't go to work because he lied in bed often because he was dizzy, and he had no way to access his medication due to the lack of accessing the roads. Thank you.
Let's see, who's next? Okay. Yeah, let's do it. Oh, yeah. Do you have that clicker? Yeah. Okay.
So it's just push it.
Okay.
So I move further.
Yeah, no, you stay there. I'm just wondering if we need a little.
She could get on the
Flaviana, are you gonna be in front of the screen?
No, I'm just gonna, I guess I
That's
can
good.
stand here.
Is it possible to move to the side?
Sure, I can
Okay,
try.
just this way a little bit. She has. Sorry.
No, that's all right. Don't worry. Don't worry. It's fine.
So sorry.
Great, okay, you're working there, that's good.
Sorry. Okay.
Oh, really? Thank you. Sorry, I was messed this up. Okay, sorry. Okay, hi everyone. My name is Flaviana Sandoval, and I'm the student fellow from Boston University College of Communication. I'm gonna talk to you about my project, which is called the Waiting List, Organ Transplants in Venezuela. So, a little bit first before I get into my actual reporting, I wanted to tell you how I came to this project and how I decided to focus on this topic. And basically, we do see a lot of, well, first of all, I am from Venezuela, so I have always been very interested in what's going on in my country. I migrated in 2010, so I have been out a couple of years now, but I always go and remain very connected to what's going on there. I have my family there, so it's always been of my interest, of course. But we do see a lot of Venezuela in the news right now. The country is going through a financial crisis that is really bad. And lately we have news about refugee crisis. We see immense lines of refugees going across the border with Colombia, and also news about economic collapse, which are all over the media in every single country that you can think of. But I realized that we don't really see much about healthcare. And although it's a topic that is widely covered in local media in Venezuela, and it's really in the public health system back home is in pretty bad shape, it's not something that you see a lot in foreign media, especially in American media. So I wanted to focus on that. And specifically, the topic of organ transplants is something that goes massively underreported, not only in American media, but even in local media, which is why I thought that this was a topic that was worth a deeper look. So these are some cool figures that I wanted to show you. So I spent 6 weeks in Caracas, Venezuela, doing the reporting. I did a total of 23 interviews, 23.1 hours of recordings, which was really impressive to me, in the sense that I have never done that much recording before. And I took 928 photos, which was also pretty crazy. So I want to give you a little bit of an overview of what I found and some numbers that I believe are important to give you sort of the main background that supports the project. So what happens in Venezuela with organ transplants is that the organ procurement system that used to retrieve organs from deceased donors to be donated to to patients who need a transplant. It's completely paralyzed since June 2017. So it used to be in the hands of an NGO that operated it, but in 2014, the government, the Venezuelan government, took control of it because they wanted to sort of transfer the management of the actual system to the hands of the state. And from then on, it started declining until in June 2017, it paralyzed completely. In practice, that means that there are no organs from deceased donors being retrieved in Venezuela as of now. Oh, sorry. At the same time, transplant centers in public hospitals have shut down consistently, mainly due to shortages of medicine and medical supplies that have widely affected public hospitals who depend on government funding. So the transplant centers that used to operate in this country, in these public hospitals, were forced to close their activities. There has been an overall decrease in transplants across the country, and as you can see, there is some figure that is I thought it was really impressive. From a record number of transplants that were made in 2012, it was 240 transplants were made in that year, to only 9 transplants done in the whole country in all of 2017. So you can see that there is an actual decrease in activity. Also, the system became really discriminatory because what happened is that as public hospitals had to close their transplant centers, now the only remaining transplant centers that are actually active in the country are in private hospitals. So, and this comes with a cost. So only wealthy patients who have the resources to pay for a transplant can access the treatment. So it's become very discriminatory. There is also severe immunosuppressant shortages. Just to give you an idea, immunosuppressants are a special medication that transplant patients have to take after they receive a transplant in order to preserve the new organ. And they have to take this for life. And recently, this medication used to be guaranteed by the Venezuelan state, and it's not anymore. So patients are actually having serious difficulties in finding their treatment. Actually, 85% of transplant patients in Venezuela are reporting severe difficulties in finding this treatment, and their lives depend on it. There has actually been some organ rejection cases. 101 patients have lost their transplanted organ because of the lack of immunosuppressants as of now, and there also have been 26 people who have died because they cannot find this medication. So from a journalistic perspective, I wanted to focus, of course, on the stories, and I got to meet a lot of people. I talked to a lot of patients. I just wanted to introduce you to a couple of them. This first one that you see here his name is Carlos Roman. He's a man who has been in the waiting list for an organ for the past 6 years, since 2012. He's currently in dialysis, and that's how he survives. But he needs an organ from a deceased donor because he doesn't have a living donor. So in the current state of things, he's just right now stranded in a waiting list that it doesn't really even exist because the government is not doing the procurement of the organs. So he faces a serious situation, and he's just waiting to see for how long he can continue. I got to see an actual kidney transplant being performed. This was at a private hospital in Caracas, where doctors were executing a transplant from a patient who had a living donor, and I got to be in the operating room and take pictures and be able to understand how the whole process worked. Here are some other cases of patients that I met. So I met Eliezer, Eliezer Aguiar is his name, whose story was really heartbreaking. He's a kid who already had a transplant in 2011, but he lost his organ due to lack of medication because he just couldn't find it anywhere, the immunosuppressants that I just mentioned. And then now he needs a new transplant. He's in dialysis right now, and he's waiting for he's waiting basically for an organ to be able to have a new transplant, but as things stand, he doesn't really stand very low chance. He stands very low chances of getting one. The case of this kid, he's called Santi. That's his mother, and it's a pretty similar case. They are both currently interned at the biggest pediatric hospital in Venezuela. It's called the JM de los Rios, and they're waiting for a transplant, and they're currently in dialysis. I met Gregory Centeno, who lost his organ, his transplanted kidney, in June after going 5 months without taking immunosuppressants because he couldn't find them anywhere, and he already lost his organ. He's back in dialysis after having received a successful transplant in 2012. These are 3 of the patients that I met who have already had transplants and are now in the phase of post-transplant trying to find the immunosuppressants that they need, and they are having a very hard time doing it. They research to things like going into social media and exchanging medication in order to be able to get that. So a little bit on the challenges from a journalistic perspective. It was really difficult to report in Venezuela due to missing official statistics, the fact that the government is not very willing to open up and talk about this. This has been cataloged as a humanitarian crisis, but the government is currently refusing to accept it as such, and they are not very open to people reporting on these kind of issues. So you have to really go all your way around to try to find other sources and alternative people for you to be able to uncover things. And so I just wanted to give you with a final thought, because this is the result of public policy or bad public policy. So it's got a lot to do with politics and democracy, and the fact that when you have a government that is not willing to accept wrongdoing, then it's really actual lives that are at stake. Thank you.
Hi folks, my name is, can you hear me? All right, cool. My name is Amanda Michelle Gordon. I'm from Westchester Community College, and I did my project on autism rights in Brazil. This was not my original pitch to the Pulitzer Center due to complications and just various issues that come with reporting. I found that it was not going to be feasible for me to do my original topic, so I looked inside myself, and I was diagnosed with autism at the age of 2. And I was still very curious about the country of Brazil, and I wanted to see for myself how this country handles its autistic population. So here we have Everson and his mother, Sonia. Everson is 36 years old. He was born in 1982. And back in the 80s, autism was seen as a mental disorder. If you were diagnosed with it, chances were that you were going to be institutionalized. Now, sorry, it's like kind of an emotional topic for me. So, I feel, nope, wrong way, yeah, wrong way. Come on. I don't like this clicker. Okay. One more. Okay, there we go. All right, I'm gonna put this down for a second. So Everson is 36 years old, and with his autism, just the country in general, it's very difficult. There are, we're assembling up here now. Sorry about that. Okay, so I'm just gonna, wing it at this point. I see so much of my own mother in Sonia. If it wasn't for my mother, I don't know what my life would have been like, I probably would not be here at this capacity with you today. And it's very unfortunate for mothers of Brazil that deal with autism that they're not able to receive the same amount of care that we are here in the U.S. And so it's kind of surprising because, do not like this one. It's surprising because, we'll get to it later, but the Brazil's laws are quite comprehensive on paper. But so just to give you a brief overdose of what autism is, it's a spectrum disorder. So it's, can you use the mic? Oh, terrible, sorry. So it generally affects communication and behavioral issues and can be gauged on a spectrum from mild to severe. There are different classifications now. The more that we learn about autism, the further the diagnosis becomes. Asperger's is actually a part of autism, the autism spectrum now. So yeah, back to the legal obligations. Back in 2012, Law 12.764 was put into place by then President Dilma Rousseff. I probably butchered her name. I apologize for that. But essentially, this law was meant to provide a dignified life for people living with autism. But what's on paper never necessarily meets what is reality. What is supposed to happen is that folks with autism should have the right to jobs, education, health care, freedom from abuse and discrimination. But the problem is that there aren't enough resources. There are many barriers to care. Money is the biggest issue when it comes down to it. I mean, money is, as people say, the root of all evil. It's just the root of all that is lacking. And for a country of Brazil, it's extremely frustrating when you look up to the skyscrapers and you can see the helicopter pads of the ultra wealthy, and then you have people living in just inconceivable conditions, homelessness that you could not even imagine. I wish I could show you those photos, but I kind of have to keep camera out of sight because the poverty is so devastating down there. Now, you also have a lack of facilities and trained specialists, and it's kind of this vicious circle because of the fact that there isn't enough money to go around. There's not enough specialists, and people that want to get into the field to help, they're unable to afford that education. We also have a lack of public knowledge overall. Again, could kind of go into money, and then there is stigma, and we'll get back to that later. All right, so these are some of the specialists and advocates that I met while I was down there. Here we have Ana Maria Ros de Melo. I probably butchered her name. I will butcher everybody's name. Again, I apologize for that if they're watching. But she is the founder and current superintendent of AMA. I'm just going to slip back for a second. So this is AMA. It's probably, no, it is the most vital resource that Brazil has of when it comes to autism. They are able to provide care as well as training programs for the autistic community in their youth. All right, so going back to Ana Maria Ros de Melo, wonderful woman. She's able to, because of her, I'm not sure where AMA would be, and I'm just extremely grateful to her for being there. Dr. Esio Valdez, he was by far the most intimidating man I met while I was down in Brazil. But he was also the most knowledgeable. Behind him is every book that you can imagine on the autism spectrum, and apparently in the door behind him is just a book just stacked, or closet stacked with books. But he's specifically works with autism. He sees over 3,000 patients in the city of São Paulo. And with him, it's again kind of frustrating because he was very intimidating, but he was also the least optimistic when it came to seeing change in the country. And I can absolutely see why he would be so disappointed in the lack of care, because he sees it every single day. Now, I wasn't able to get Dr. Maria Rita dos Santos and Pasos Bueno. Everybody has really long names down there. But she is a professor of genetics at the University of São Paulo. And she brought up a really interesting fact to me that down there's an old wives' tale that autism is caused by cold or cruel mothers, and that is quite opposite of the case. It's just really not the case. The biggest advocates for the autistic community are the mothers. This is Maria Alice Dureta Pera. She is a coordinator of the education of the district of Barretos. So she's also another key advocate person. She's seeing a lot of success because of the implementations that she has put out. Okay, so why does this matter? Autism can be found all around the globe. It does not discriminate against any race, gender, socioeconomic class. And within Brazil, there are a lot of stigmas against the folks. There were a few people that were also higher functioning that I met while I was down there, but they weren't able or they didn't feel comfortable coming out with their diagnosis because they feared of losing their jobs, the repercussions that would come because of the stigma. There's a belief that if you have autism, you are not able to do anything. And as someone who has autism and is here today, it's extremely frustrating to hear that anywhere in the world. So I'm a big proponent that social policies, media, has a better impact on changing the world than politics. By making people aware of autism, what it is, and how it works in the world, that people will be more aware of it. Now this is a comic, Monica and Friends. Unfortunately, this is the only time that autistic character is introduced in this comic book series. This is essentially the equivalent of our Mickey Mouse or Bugs Bunny. But if America was to take a stronger stance on being more aware of the autistic community, I think that would echo not only to Brazil, but to the rest of the globe. Thank you.
Hi everyone, my name is Merdie Nzanga and I am a senior at Howard University and my project is on female genital cutting in Kenya. So I will proceed now.
Do you want somebody to click for you?
That'll be great, thank you. I only have 3 slides, but I'm gonna try to talk as much as I can. Go ahead. All right, so I'm very passionate about journalism, and before I do any type of reporting, I always ask myself these 3 things. They are, what are my objectives? The first one is to seek the truth as a journalist. The second one is to hold the powerful accountable. And the third is to be the voice for the unheard. And move on to the next slide. So, I chose the topic of female genital cutting. I should go on the next slide. I'm supposed to be the other way around. Thank you. Female genital cutting, the United Nations and World Health Organization describes female genital mutilation as a partial or total removal of the external female genital organs for non-medical reasons. Per WHO, the World Health Organization, over 200 girls and women have undergone the practice in 30 different countries in the Middle East and in Africa and Asia. FGM is mostly targeted towards girls under the age of 15. And it's been considered a violation of human rights according to the United Nations. So you can go on to the next slide. That was the last one. Oh, sorry, go back. All right, so how I came about this project. So I chose my topic on female genital cutting because I'm very passionate about women's issues and issues that are impacting women across the globe. So I wanted to explore more. I've heard the topic before and there's been a lot of reporting on it, but I wanted to explore more what it actually is and how it impacts people. So I chose my topic on female genital cutting, and my story is on how the Kenyan government is prosecuting its 2011 FGM ban that it placed in 2011. They passed a law to ban it in the country, so it became, by law, technically illegal. I have not gone on my trip yet. I will be leaving in December, so I will present to you guys kind of the pre-reporting that I've done and the sources and the people that I've spoken to so far. So, the government. That was just this, 3 slides. But, no, okay, so carry on. So let's start with the cultural aspect. So way back in time, it's been a cultural thing in Kenya. It's kind of like a rite of passage for women and girls. So if you're not cut, you're really not a woman. And if you are cut, you're considered a woman, and it's kind of like a rite of passage, like, yeah, you're a woman, in addition to childhood marriage. So it's been practiced for years and years going back. And one of my sources, the first person that I spoke to is an anti-FGM activist, and he happens to be a man. His name is by the name of Samuel Leodoso. Samuel decided that he wanted to get involved with this. He's from the Samburu tribe, which is one of the communities in Kenya. He decided that he wanted to get involved with this because he saw the pains of his sisters and his mom, all the women in his life that underwent FGM, and he wanted to basically change the law. And so when Samuel went to a university in Nairobi, the city, he got educated about how it impacts women. So he came back and he was like, I'm gonna do something about this in my community. And so Samuel is kind of seen as a target because the elders in the community don't like this. Even though like the law passed, it's still really like basically, it's still being done like illegally. So the elders are still like cutting girls and the parents are still basically allowing it to happen. And so Samuel is seen as this guy who, here you are with your, how dare you, with your Western views, try to come and tell us what to do with, you know, something that we've been doing in our culture for years. And so he's been seen as a threat to the community, and he's disrespectful because he's basically trying to educate his people and tell them that there are health issues and health concerns to this. And so he basically, he's one of the very first people that I interviewed so far through my reporting, and he tells me that basically in his community he's seen as a threat, and the government, he has the protection of the government, but he tries to educate girls and parents about why it's wrong, but the elders aren't having it. So they're like, we're not gonna talk to you about this, it is what it is. And so he's one of the people that I'll continue talking to. And then the other sources that I have here are people, basically the anti-FGM board. So they are people placed by the government to kind of basically follow up with this law and why it's wrong. And so like to just hold people accountable. So the anti-FGM board, according to my report, it doesn't look like they've been successful in basically trying to stop people from practicing it, because really how do you stop them when it's really done under the table, and most of the time it's done at nighttime. So I have more questions now for them. It's basically, the first is like, how are you keeping track of the people that are actually doing this, right? Who do you have placed in store to kind of take care of this? And then you also have lawyers that I'll be speaking with, and they'll basically break down, because it's kind of like a lengthy, I try to read it, it's like British English. So like, just explain it to me as if I were a 6-year-old, just talk to me step by step, what does this law really mean? Like, so who is who, and why did you decide to put a board, and why did you wait until 2011 to basically ban this law if it's been, you know, if it's been a violation of human rights forever? So why wait that long? And I'm also talking to the police and asking them how are they also keeping track of what's happening, right? And going back to Samuel as a male, Samuel, who was the activist, why did you decide to get involved? Well, he talks about his mom and his sisters, but as a man, how has this impacted you? Like, why did you decide to pursue this? And how do you basically keep yourself safe other than the government? And do you believe that women are more empowered by having men on their side? And I'm also going to be talking to experts and doctors from a health point of view. What does this really mean? Like, is it more harmful than good? Like, what are the dangers of this practice? And then talking to people on the opposite side, because we want to give everyone a fair chance. Someone that as I was doing my reporting, I came up with Dr. Tatu Kama. She is a doctor, and she believes that by placing this ban, you are basically taking away women's rights. So the questions that I have for her is basically, as a medical professional, like as a doctor, according to some reports that this is a very dangerous harm, why are you still deciding, do you care more about protecting the culture than protecting people's rights? And so just asking her those questions and just kind of going more in depth. I do have a fixer, so we've set up kind of a schedule of what's going to happen when I get on the ground, but I'm going to keep reporting and seeking more questions, and hopefully we'll seek the truth. So yeah, thank you.
Hi everyone, I'm Julie. I'm from McGill University in Montreal, Canada. And this summer I traveled to Nunavut, to Iqaluit and Pangnirtung to report on food insecurity. In Nunavut, approximately 70% of preschoolers live in a food insecure household, so it really is rampant. So the goal of the project was to determine what federal and territorial programs and policies are perpetuating this food insecurity, and what the impact of the hunger, what's the impact on their health. So first of all, here's a map. This is Iqaluit, the first dot here, and then that's Pangnirtung. Nunavut has approximately, it has exactly actually 25 communities, and these are two of the more southern ones. I did originally want to go way further north on Baffin Island, up to Grise Fjord, but right from the beginning, it was very obvious that that would be impossible because it would cost nearly $8,000 just to get there. So understanding that barrier, the barrier of even just visiting, is a step in understanding food insecurity in the north to begin with, because a lot of it has to do with isolation. All food that's sent up to the communities is sent either by plane or by cargo ship once a year when the ice is thawed. So it's extremely, extremely expensive to get anything up there and then to store it and to have the energy to store it as well. Everything is just multiplied by 10 by 20 compared to southern Canada. That's just an image from the plane between Qikiqtarjuaq and Iqaluit. I had to go to Qikiqtarjuaq, which is higher up, to come back down to when I was going back to Iqaluit. So basically the federal policy, the federal program that's run is called Nutrition North, and it's a subsidy program where there's a $2.30 subsidy per kilo, or $0.5 per kilo, depending on the scale. That's put on the top of the supply chain, and then that's supposed to be sent down, passed down to the customer. However, the Nutrition North only covers healthy foods, and it doesn't cover many staple items that are required for survival or for a dignified life, like toilet paper or lots of different just necessary items. And unhealthy foods are not covered either. So you can find foods that are kind of like a crazy price. There's a Facebook page that's really quite used by the Inuit called Feeding My Family, where there have been posts of like $70 watermelons, or when I was up there I found a $14 honeydew melon, or $50 toilet paper, just to give you an idea of how expensive it is. And another thing is that because everything has to come in by plane and there are often delays or flight cancellations, food often arrives either expired or completely wilted, and that's all that's available. When I was in Pangnirtung, the flights were canceled for 5 days straight, so basically all of the fresh produce was going bad or absent on the shelves. So now to understand a bit of what the culture is in Nunavut, there was a kind of a transition in the 1950s, from the 1950s to the 1970s. The Inuit were forced to kind of relinquish their nomadic, hunter-gatherer lifestyle and become sedentary. And this was accompanied by a food transition as well, because up until that point, their diet was based on country foods such as Arctic char, caribou, seal meat, and different berries and whatnot. And then it became store-bought food. But because Inuit culture depends very much on elders' knowledge, this left a complete disconnect between what the elders knew and could teach and what the youth needed to be able to cook and budget and buy nutritious foods. So we've now got this situation where the easiest way kind of to feed your family is to be going for the processed, ready-made meals over the kind of unknown, nutritious, expensive foods that are not necessarily available anyways in all communities. Okay, this photo didn't really come out well, but it's a man in front of a cabin. This is a shed by the beach in Iqaluit, and it's there's a family of 7 that lives in there. Just to give you an idea, I wanted to bring in the aspect of poverty as well, because there are lots of social determinants of health that affect the Inuit that don't necessarily affect most Canadians. If you look at even high school diplomas, only 34% of Inuit Inuit adults have high school diplomas versus over 85% of all adult Canadians. And if you look at the salary of non-Inuit people working in Nunavut, mostly government workers, it's $92,000 a year versus the Inuit median salary of $23,000 a year. And if you consider the cost of food, it's basically impossible to make ends meet. Income assistance, which is essentially supposed to cover the cost of food, is $682 for an individual per month, and that is only really covers about 60% of what food actually costs. And if you look at the different programs that are available to help people gain financial independence, they basically are not robust and don't apply to the north because there are no infrastructures. There's no rehab centers if you have an addiction. There's only one hospital for the entire territory. Most communities don't have that many jobs because there's just no industry. A few communities have government offices and whatnot, but many do not. So there's really just a school, a health center, different stores and fisheries sometimes, but that's about it. So it's really a vicious cycle of people living in poverty, not having enough money to live. The income, the income assistance they're receiving is not enough, and they're left trying to survive. And in Iqaluit, in all of Nunavut, actually, there's a homelessness problem and overcrowding. And so this particular family of 7 has they have an 8-month-old baby. They're living in a shed that has no running water, no heating, and this is a place where it's like you go below 65 degrees Celsius sometimes, and so they're gonna have to get out before the winter. But this is Family Services knows about these 5 children living in the shed, and that's just, to me, that's incredible that in Canada this is happening. Yeah, and then if you look at other things such as, so this is Inuktitut. If you look even at federal forms, if you want to, for pension plans and all these different benefits that you can receive, none of them are available in Inuktitut, which honestly is very hard for many people to then be able to receive these benefits, especially in communities that don't have cell service or internet access. So that's just another way that people are living in poverty without being able to do much about it. There's also a poverty reduction plan that was created in collaboration with different Inuit organizations and the government in Nunavut, but there were no baseline data that was taken, and there was no policy definition of poverty to begin with. There's a food security coalition that's been created as well, but that also has many flaws and is lacking kind of robust membership, and there's a lot of turnaround. So there's a lot of kind of stagnant stuff in food insecurity in Nunavut. In terms of health, this is the hospital in Iqaluit, the Iqaluit General Hospital. It's basically when I was talking to different public health nurses and physicians, what came out of it was realizing that children in particular are hit by this. There are children with rickets in Canada, which is vitamin D deficiency. This is not normal that children would have this. It's very, very rare. There's teeth that are decaying to the gums. Missing teeth are like completely normal in children. Iron deficiency, anemia, all these things that are just ridiculous and all linked to food insecurity. And now this picture was cut a little bit, but it's, I just wanted to leave you on the story of someone. So this is Annie. It's a different name. It's not her real name, but it's the name I used in one of my stories as well. She lives with her 6 children, her spouse, her cousin, her spouse's cousin, and their nephew, all in a 3-bedroom apartment. One of the bedrooms, and it's free housing, and one of the bedrooms is so moldy that it's unusable, and they're living on child tax benefits and income assistance to try to make ends meet, but it's near impossible. And this is the story of so many families in Nunavut in Canada. So that's it. Thank you for listening.
Thank you all. That was terrific. You all did a great job. Do we have questions? Yes.
Hi, my name is Amna. I'm a graduate of Northwestern University in Qatar. And I have a question about FGM. So where I'm from, and in a lot of places in the Middle East, when it comes to women's issues and things are against the law, usually when police are called for help, we don't really see them reacting because they don't want to go against the family and they don't want to go against community elders as well. So I just want to know, in the research that you've done, what is the police's response to calls of help or circumstances?
That's a great question. I actually have not been able to talk to the police, so it's funny that you asked that. It's been really hard to kind of, different country to just kind of get a hold of some sources, but that's one of the questions that I do want to ask them is how are you doing it? Are you keeping track of these people that, you know, that are practicing this, basically? So we'll see. I'll let you know.
Thank you. Yes.
Hi. So my question was for Flaviana. I know that in the U.S. there's a lot of problems with reporting on hospitals and like HIPAA violations. Are there any situations like that that you encountered, or how is it different?
Yeah, well, Venezuela's case is, it's actually really interesting. It's really tough to go and report in hospitals, especially when they are public hospitals. So whenever you're at a private hospital, it's much easier because you have much more freedom to just go around and take photos and do pretty much whatever you want. But then when you're in a public hospital, public hospitals in Venezuela are actually under control of the government, and they are guarded by militiamen, so who are there specifically to catch journalists or whoever else is wandering around doing things that we are not supposed to do, in their view, of course, which is not mine. But yeah, so it was very challenging. Usually what I did was, well, I would get in contact with patients who were inside the hospital, and they would help me get around, and patients are really often willing to talk, so that was the way to get inside. And you needed to be very careful with avoiding militiamen patrolling the corridors at all times. Actually, some of the photos that you saw were taken in public hospitals, and they were taken with a cell phone that was hidden most of the time because I couldn't risk to be kicked out if I was discovered by them. So it was a very challenging part of the reporting.
Okay, let's start here and then AJ and then
You start. Oh, yeah. This is for Flaviana. Hi, I'm AJ from Davidson College. This is for Flaviana.
So you've alluded to this a little bit, but could you speak more about how Maduro's, what are the political and economic sort of consequences of Maduro's regime and how they've exacerbated the organ transplant crisis when you were reporting? Like, what were the actual implications of what it was like on the ground there and what's happening now?
Sure. Well, I have to start saying that it's a really complex situation. I don't know that I can really explain how complex it is in just the short time that we have. But it's definitely, so the crisis, the healthcare crisis, and most specifically the organ transplant crisis that the country faces is definitely one of the many consequences of the economic collapse of Venezuela, and which is of course related to public policy and the way that Maduro's administration has been acting. So it is definitely related. And one of the things that I realized during my reporting was that the fact that all this happened started with bad policy in terms of managing funds, and how, because public hospitals are funded by the government, and the fact that there was corruption and mishandling by the government's part, that caused that hospitals are no longer having the funds that they need. They're completely underfunded. Then you also have shortages of medicine because Venezuela needs to import most of the medicine that it consumes for patients, because the local industry has also completely collapsed, and the pharmaceutical industry in Venezuela is almost non-existent, in the sense that we do produce some medication, but it's mostly imported from other places. Right now it's mostly from India. So it's a mix of, it's a very chaotic mix of things. But definitely Maduro's administration and Chavez's before Maduro's, they do have a responsibility over what's happening. And what is most severe, I think, is the fact that their government is not even willing to recognize that this is happening and that patients are facing this crisis, because they don't want to admit that it's an administration issue. So that's why we have this, and it's really tough.
Hi there, I'm Jared from Flagler College. I had a question for Amanda about Brazil. So it looks like at this point that Brazil is going to see an extreme far-right president rise to power. It looks relatively certain. Do you fear, from what you have seen in your time reporting in Brazil, or do other people that you interviewed, do they have apprehensions that this is going to create a further marginalization of autistic or people with autism?
Absolutely. So AMA was one of the places that raised resource for autism and people living with autistic people and their families. There's also a bunch of smaller organizations, but there's a huge fear that with the most likely incoming president, which they refer to as mini Trump down there. I know that you guys probably seen it in the media too. But AMA is 80% funded by the government right now, and with the far right leadership, there is an absolute fear that that could.
Has been these sort of networks that have created within social media of patients interchanging or exchanging medication, or sometimes even exchanging medicine for example, food or different products, because it's just become so hard to be able to find the medicine through the regular mechanisms that that people are supposed to be able to do, but they can't anymore. So it's become really kind of even sort of a movement now to use social media for this. But like going deeper into your question, I don't really think there is government censorship when it comes to social media. In this topic, there is government censorship towards social media in another
degree, and I'm finishing a project with National Geographic, funded by the Pulitzer Center and the Guggenheim Foundation. And Julie, you knocked it out of the ballpark. It's like, the Arctic is really hard to report on. There are places where it's $8,500 round trip. Like, I could fly around the world. I can go almost anywhere in the world for a quarter of the price of the Arctic. But I think when we look at the Arctic, we have to look at the symptoms of what Julie's talking about, and that it's the place where climate change, scientifically, like when you go up there, it's not, you're like, whoa, the ice is not there anymore. Scientifically, the numbers, it is the place being impacted and destroyed at the quickest level, and will destroy us in the south faster in all the places like Venezuela, the Middle East, Africa, Europe, and here. So I wonder, Julie, if you can just share sort of what are the community conversations going on? Because when I think of scientists, Inuit are the ultimate scientists. Scientists are people who collect information. They've been collecting information for centuries. So I wonder if you can share some of your insights.
Yes, in terms of the environment, the people that had the most to say about that were the hunters and the elders, who seemed to say it was mostly the changes in the roots of the animals, the caribou roots, even areas on the ice where they would be able to go hunt have completely changed. There's places where the ice has thinned so much that if they were to hunt in a certain time of the year, they would just go right through the ice, whereas that was a prone hunting place before that. I didn't get to speak to a lot of hunters, so I didn't, in terms of climate change, I don't have a lot more insight to share than that, unfortunately.
Okay, let's see, more questions?
Hi, my name is Monica Long, and I am a graduate student from Colorado and Lansing University. And my question is for both Amanda and Alexis. Both of you ladies spoke about autism as a disability and disabilities that have caused people to use wheelchairs. And I just wanted to know if there was any research on support groups where you ladies both traveled, and if so, were you able to attend those support groups?
Alexis, why don't you start?
Sure. So where I was, there were no support groups that I could attend, unfortunately. But I mentioned Mavi, and that was the only program that people with disabilities in Puerto Rico relied on, because it was the only one that existed, you know, for all the services that they offered. So if it wasn't Mavi for, let's say, housing resources or, you know, independent living resources, there were programs, I forgot the name of it, so excuse me, but there were programs for parents to go to, specifically for people with children with autism, and they would go around as parents to share how they've had difficulties or growth with their children and raising them, and they would be supportive of each other that way. But I didn't get a chance to go to anything of that nature because I wasn't aware of any support groups that were going on at that time. So, yes, thank you.
Thank you.
To answer your question, AMA is probably the biggest proponent of support groups, but it's mostly geared towards the youth, just to target autism at an early age and help build skills through this disability. But for older people, no, there isn't really a whole lot of resources where people can come together to talk about. As I said in my presentation, there is a huge stigma. However, I find that with AMA as well as some of these other smaller organizations, Sonia Hefferson's mother goes to AMI. I'm sorry, I'm throwing these acronyms at you guys and you don't even know. AMI is I'm not going to be able to say it in Portuguese, but it's essentially the Association of Loving or Gifted Mothers. So through these organizations, I feel that it's also a place for parents with autistic children can come together and pull each other through this time. So thank you for the question.
Thank you. And before we wrap this up, I have one question. Do we have another question? Oh.
You can go first.
No, I want to have you last.
Hi, my name is Isla, and I'm from Northwestern Qatar, and I have a question about your FGM pre-reporting. So, like, I think many would agree that, like, religion and culture can be, like, blinding motivations to an extent. So, like, when it comes to these female victims or activists, like, was there any outcry or objection historically before external intervention? Or was it not until, like, Western opinion was like kind of incorporated that this became an issue opposed to like a tradition?
That is a really great question. Based on what I've done so far, I think when I was talking to Samuel, the activist, and he said it's very much a Western influence on even when he went to school. They would have these doctors and these health professionals, they would educate them on why this is a very dangerous practice from a health point of view. So because it's been, I don't want to speak for other people, but he said that basically the Western world has had a very strong influence on him when he went to school in Nairobi, at the University of Nairobi, and his white teachers and people from like Great Britain and all of that, like the Americans were coming down and basically educating them on why this is an issue. And of course you have the United Nations and the World Health Organization there. So yeah, I think so. But that is a great question, and I can definitely look into that more.
Okay, I think we're going to wrap this up, but before we do, I wanted each of you to respond to a comment from Amanda's presentation, which was about can the media alter public opinion? And you were talking about that in relation to autism, but maybe each of you could just say a word or two about the role of the media in altering opinion in regards to whatever your reporting project was on. So why don't we start with Flaviana and then just go this way, and just a sentence or two.
Okay, well, short, yes. I do believe that the media has a very big role to play in this. In the specific case of Venezuela, it has played a role, and the thing is that with the government not being willing to admit that this is happening, it's really hard. But at least I do believe that the media does have a role in creating awareness that this crisis is occurring.
I would agree with that for Northern Canada as well. There has been a lot of media already, of media coverage of food insecurity in Canada, and we're still the same kind of place that we were before, so I can't say that it has been completely instrumental at this point. I think it really is that all the stakeholders and actors have to come together, the Inuit organizations and the government, the federal government and territorial government, to really kind of act change beyond just the media at this point.
So yes, I do believe in what I said. And to further go into that, what I would like to see beyond news media would be, like with the cartoon, Sesame Street here in America has been a huge factor in autism awareness. Its theme park actually is now essentially certified to care for an autistic population. So if, say, Disney or Marvel were to release a character that was on the spectrum at some degree, I think that would make huge waves for neurodiversity.
I do believe that the media does alter public opinion, obviously, with FGM. When you think about it from like a Westerner's point of view, you have this doctor who's basically saying that how dare you people in the West try to come and try to hurt our culture. So they've always looked at, I guess, those of us in the West, we've always seen FGM as kind of like a issue, but we don't know the cultural side of it. So I definitely think that the media has a big impact on what we view and how we look at it. So yeah.
Yes, thank you. So for me, I do believe that the media does have a big impact on Puerto Rico, because I feel as though people could use it to say more like how they feel as though FEMA could help people with disabilities, and the more that their voices are out there, the likely chance that the government will be able to do more for them, and hopefully not just only help out people that don't have jobs, help everyone out. But if people don't necessarily have electricity still, that could be a barrier. So thank you.
Okay, well, thank you all.